Hiccup, causes and home remedies. Most people experience hiccups from time to time. They can be uncomfortable and sometimes embarrassing, but they are usually short lived. Sometimes, however, they can indicate a more serious health conditions. Folk remedies for hiccups include drinking water and giving someone a shock, among others. Non, not all of this will work, but some may help. Recurring or long term hiccups can indicate a serious underlying cause, such as neurological damage. For this reason, people should seek medical help if hiccups last for longer than 48 hours. Some less concerning causes of hiccups include eating too quickly and taking a cold shower. In this video, learn more about what causes hiccups, how to stop them, and when to see a doctor. What are hiccups? Hiccups result from a muscular spasm that happens when a person breathes in bursts of air. The Latin name of hiccups is singultus. It comes from the word singuled, meaning to catch one's breath while sobbing. When a person breathes in, they use the intercostal muscles between the ribs and the diaphragm, a dome-shaped sheet of muscle below the lungs. Usually when a person takes a breath, the diaphragm pulls down to draw air into the lungs. As they breathe out, the diaphragm pushes up to expel the air. When a person has hiccups, the diaphragm contracts and pulls down, drawing in air between breaths. Immediately after this, the windpipe closes for a moment to prevent more air from entering the lungs. This produces the characteristic hic sound. Why do hiccups occur? There are several reasons that hiccups occur. The sections below describe this in detail. After eating or drinking, hiccups often come after eating or drinking too much or too quickly. The stomach, which is directly below the diaphragm, becomes distended. This irritates the diaphragm and causes it to contract, as it does when we breathe in. Other digestion related activities that may trigger hiccups include gulping soda, heartburn or acid reflux, consuming alcohol, smoking a lot, swallowing air including during hyperventilation, eating hot then cold food, or the other way round. Emotional triggers. Sometimes hiccups occur due to a disturbance in the nerve pathways that lead from the brain to the muscles between the ribs. This can cause short-term hiccups following an emotional shock or stress, excitement, and abrupt change in temperature, such as by taking a cold shower. Other reasons. Hiccups can also occur when a person overstretches their neck, such as when shaving, takes certain medications, needs anesthetics during surgery. Medications that can lead to hiccups include some chemotherapy drugs, benzodiazepines for anxiety, opioids, pain relief medication. Persistent hiccups. Persistent hiccups are those that last for longer than 48 hours. Sometimes an episode of hiccups can last for longer than 2 months. Doctors call this intractable hiccups. This could be due to a problem with the brain or spinal cord. The structures around the diaphragm or chest wall, blood composition such as high blood calcium levels, the stomach if it presses on the diaphragm. Conditions that involve hiccups. Hiccups can be a symptom of an underlying health problem. For example, they are a common occurrence in gastroesophageal disease. Some people with cancer might also experience frequent hiccups. This may be due to their symptoms or some aspects of their treatment plan. A wide range of other conditions can increase the likelihood of hiccups, including infections. Examples including shingles, herpes, simplex, and malaria. Neurological conditions. Examples including aneurysm, stroke, Parkinson's disease, and multiple sclerosis. Ear, nose, and throat problems. Examples include cough, having a hair in the throat, and recent intubation. Respiratory conditions. Examples include pneumonia, asthma, and bronchitis. Metabolic disorders. Examples include diabetes, uremia, and hyponatremia. Cardiovascular disorders. Examples include heart attacks and pericarditis. Complications and when to see a doctor. Complications. Persistent hiccups can lead to embarrassment and a reduced quality of life, nausea, weight loss, sleep loss, fatigue, dehydration, sadness, anxiety, and depression. Both the causes and the impact of long-term hiccups can be severe. When to see a doctor. People should see a doctor if hiccups last for longer than 48 hours. They happen often. They affect a person's comfort and quality of life. Home remedies for hiccups. People use a number of remedies for curing short-term hiccups. Some of these are useful, but others are not. Here are some that may help. Hold the breath for a short time. Pull the knees up to the chest and lean forward. Breathe into a paper bag. Take a few sips of ice-cold water. Have a taste of lemon or vinegar. Swallow a little granulated sugar. Drink a glass of water which will stimulate the nose and throat. Hold a cold compress to the face. Experience a sudden fright. Breathing into a paper bag can halt the spasms by increasing the amount of carbon dioxide in the lungs and relaxing the diaphragm. However, people should not put the bag over their head. Other methods that people have tried include hypnosis, acupuncture, rectal massage, sexual stimulation, ejaculation. There is not enough evidence to confirm the usefulness of many of these approaches. Things to avoid. The following methods are not suitable for stopping hiccups: consuming alcohol, hot drinks or sodas, chewing gum or smoking, eating spicy food, eating food quickly, eating something hot followed by something cold. These techniques may make hiccups worse.